We combine the patient's desires with the tools and technology we have available to be able to provide them with the solutions that they're seeking for. One component of a consultation is definitely to take some impressions. It used to be that you had some material that was mixed in an impression tray, very gooey, placed in your mouth, would sometimes go down your throat and sometimes give you a very unpleasant experience. We don't do that in our practice anymore. What we have done, we have gone into optical scanning. It's a way of taking a picture, making a mold of your mouth without having to put this gooey material in your mouth. And what that does is, not only it's very, very accurate, it allows us also to simulate the treatment that we're doing for you. One modality of diagnosis that we use here is a 3D dental CAT scan. It's an X-ray that takes a three-dimensional image of the patient's jawbone, and that allows me to assess that bone in many angles, and I'm able to determine the size of the implant, to determine if there's need for extra bone, or if the quality of that bone, where we plan on placing those implants. Things change very quickly in implantology like in other fields. For example, recently we have adopted the use of the PRF, which is a technology where we can harvest the patient's blood, spin it, and use it back into their body to improve healing, to improve bone, to improve the amount of gum they have if they're deficient in that sense. But also, it accelerates healing. It decreases the amount of swelling and inflammation and pain they will have after the procedure. I really want the experience to be a positive one. Yes, it's surgery, but today we have technology and techniques that can make that experience a lot smoother.